Mental Health Masterclass, Anxiety, to understanding anxiety and panic symptomology. As people, it is natural and normal at times to experience worry and anxiety. At different times in our lives, we'll all be challenged with these feelings. No matter what our age, we will feel worry and stress. You may see a spider in your house and feel worried or stressed when you can't find where it ran off to. Or you may feel nervous when speaking in front of a crowd or playing in a sporting game. Our anxiety at times supports us, protects us, and helps us manage concerns. This particular anxiety response has often been referred to as the fight, flight, freeze, or faint response. You may be faced with a situation where you feel challenged, stressed, even threatened, and you experience a change within yourself. You may respond by fighting, you may freeze, be unable to act, or you may run away. You may even faint from the distress. Often these responses occur unconsciously and without warning. Some people, including children and young people, respond and react very intensely to these distressing situations. Often these feelings or worry or nerves or fight, flight, freeze will cease when the situation or distress passes and you are able to return to your natural state of being. When anxiety is present as an ongoing response, we need to consider whether a person's anxiety is starting to impact their ongoing functioning. When this occurs, the ongoing sense of dread and worry, we would suggest this individual is struggling with anxiety. Anxiety is one of the most common mental health concerns people will experience or be diagnosed with during their life. Children and young people are not immune to this. Anxiety is more than just feeling stressed or worried. While stress and anxious feelings are a common response to a situation where we feel under pressure, they usually pass once the stressful situation has passed or stressor is removed. Anxiety is when these anxious feelings don't go away, when they're ongoing and happen without any particular reason or cause. It's a serious condition that makes it hard to cope with daily life. When we explore anxiety symptoms, it can be really helpful to divide them into 3 groups: physical symptoms, psychological symptoms, and behavioural symptoms. If an individual is experiencing physical-related anxiety symptoms, you may notice the following: racing heart, sweaty palms, shaking hands or legs, hot or cold flushes, stomach aches or headaches. If an individual is experiencing psychological-related anxiety symptoms, you may notice the following symptoms: conversations around ongoing thoughts of worry, thinking the worst of situations and analysing ongoing concerns. This kind of rumination can cause ongoing distress and worry. If an individual is experiencing behavioural-related anxiety symptoms, you may notice the following: isolation from those they love and spend time with, or avoidance of situations which cause distress. Some individuals may experience symptoms in one domain more than others, whilst another will experience symptoms across all 3 domains. Each person's experiencing of anxiety is different. When working with children and young people who experience anxiety, we must remember, like adults, they will each experience it in their own way. There are certain risk factors for children and adolescents which may increase the possibility of an anxiety disorder. These include trauma, challenging life events, grief and loss, a personality who is more vulnerable towards anxiety, family history of mental ill health, or a secondary diagnosis. You may be working with a student who is vulnerable to develop an anxiety disorder due to challenges in life they have faced. If we break anxiety down even further, what we see is there are different types of anxiety children and adolescents experience. These anxiety concerns are usually spoken about as generalized anxiety disorder, social anxiety, separation anxiety, specific phobias, acrophobia, and panic disorder. Whilst you may not be aware of the specific anxiety diagnosis of the child or young person, by being aware of the symptoms and challenges they experience, it will enable you to support and care for them. Panic disorder is one anxiety diagnosis which impacts greatly upon children and young people. When we discuss and look at panic, what we must remember is that a panic attack occurs for a discrete period of time with the following symptoms present. The individual could experience physical symptoms including palpitations, pounding heart or increased heart rate. Other symptoms may include sweating, shortness of breath, chest pain, and possible discomfort, feeling hot, dizzy, faint, or even lightheaded. Young people have also described feelings of derealization, not feeling real or within reality, experiencing strong fear of losing control, or feeling like they might die. Panic can be debilitating for the individual who is experiencing it. To be diagnosed with panic disorder, an individual must experience a panic attack. The feelings they will have another panic attack and experience ongoing panic attacks within a month following the first one. Exploring the challenges children and young people face who struggle with ongoing anxiety and how to best respond. As educators, at some time during your working alongside children and young people, you will support a student who is struggling with anxiety. Managing and supporting a child or young person with ongoing distress and worry in itself may cause anxiety for yourself. However, you, as a teacher, have the great ability to connect and work to support students to learn how to manage these feelings. Being able to recognise an individual who is struggling with anxiety can provide a sense of safety and security, so the young person is able to share their concerns. You need to show empathy and compassion to the individual. It's not about fixing or providing the intervention. It is enabling you to step in and assist the child. Reassuring the safety of the individual by speaking to them about their concerns and ensuring them of the safety that being with you can provide will allow the person to begin to calm and the physical symptoms will lessen. Once the panic has subsided, encouraging the student to return to regular activities is really important. This consistency will assist children and young people to manage their distress and build an ongoing sense of safety after they feel distressed. Developing confidence to support a child who is struggling with anxiety within a school setting. By familiarising yourself with the symptoms and responses of anxiety, as an educator, you will grow in your confidence and capacity to support students who are struggling. You do not need to be an expert mental health clinician to support individuals struggling with anxiety. This session and information provides you with the knowledge to recognise symptoms and behaviours, but also to encourage you to step toward a child and young person struggling. When you are with a child or young person struggling with anxiety, your next steps would be as follows. Listen to their concerns. By listening to a person's distress, you are validating their experience and their ongoing concerns. Showing you are listening will assist the individual to manage their responses. When people feel validated and heard, they are able to learn to grow in their ability to manage their uncomfortable feelings. Reassure their safety. You see them, are with them, and are able to support them even when they are feeling distressed. Show empathy and compassion. In this space, we are allowing the child or young person to know that what they say is okay. They won't be judged or in trouble for sharing. Be clear about your next steps as the adult. Children and young people respond well to process and are able to follow when processes are given to them. If you need to take next steps to show continued support or need to speak to their parents or another staff member, by being clear with the individual, you will continue to build the relationship between the two of you. Speak to them about their physical symptoms. Assist to normalise the strong feelings and concerns that they are having in order to normalise they are experiencing anxiety, and while it is challenging and distressing, the feeling will pass. Refer to appropriate referral pathways. Obtain support for yourself if you feel as though you are struggling to support children and young people with ongoing trauma and distress. At times, our own vulnerabilities can be impacted by the support we provide, and you may need ongoing care and supervision to maintain your own health and well-being. Case study, Anxiety Case, Study 1, Mental Health. Mia is a 14-year-old female who is in mainstream. She is in Year 8 and has been a new enrolment to the school this year when she and her mother moved into the area. Upon enrolment, Mia's mum, Donna, had shared school as a difficult place for Mia. She does not enjoy attending. This comment was just a passing one, but the head teacher wellbeing noted Mia as a student he will need to check in with. Mia is quiet in both class and in the playground. She has a small group of friends, but as shared with her year advisor, she finds it hard to connect with others. When speaking with any staff member, Mia's left hand often shakes, and she does not look you in the eyes. She is often muddled in her words and reports she struggles to get her thoughts straight. Case study questions. What changes in behaviour have you noted? Quiet in class and playground. She has reported to her year advisor she finds it hard to connect with others. What mental health symptoms is Mia displaying? When speaking with staff, her left hand shakes and is unable to look you in the eye. She reports she finds it difficult to share her thoughts without being muddled. What are your next steps from a school perspective? Speaking with her around her current concerns for school, speaking with her mother to gather further information about her past history of schooling, ongoing connection with the welfare team at school. What further information would you need to obtain? Current supports which may be in place for Mia. What supports would Mia like to engage with her in assisting her at school? Sharing of information from her previous school. What referrals, pathways would you consider? School counsellor referral for Mia. Encouragement for linking with a GP for further long-term psychological supports for Mia. Case study, Anxiety Case, Study 2, Intellectual Delay and Mental Health. Jacob is 8 years old and attends a local primary school. He has been placed in a mainstream class and has an aide for support an hour a day in the classroom that is specially for him. He has been diagnosed in kindergarten with a global developmental delay, and his teacher has noticed that whilst being in a mainstream class, he struggles to manage the activities set for him. Jacob resides with his mother Stephanie, stepfather Michael, and 2 younger siblings, Georgia 6 years old and Eliza 3 years. Mum has reported when she was pregnant with Jacob, she was a victim of domestic and family violence. When Jacob was born, his father David moved interstate and there has been minimal contact. Jacob's stepdad Michael is father to both Georgia and Eliza, and mother reports Jacob has struggled with his transition of becoming a family of 5. She has noticed at home he often plays alone and becomes quiet when Michael speaks with him. Stephanie recently shared with the teacher she's been diagnosed with anxiety and is currently on medication. She believes Jacob is not aware of her ongoing mental health concerns or was aware of the violence when he was born. His teacher has noticed in the classroom that Jacob will only play on his own, will not speak in class if a question is directed toward him, and becomes upset easily. Jacob will cry, and the teacher notices his arms and legs shake. On the day Stephanie picks him up from school, he appears to be settled and happy to see her. However, on the days Michael completes school pickup, Jacob will cry and not want to leave the classroom. The teacher notices the leg and arm shaking in this context too. The teacher has advised the learning support team that he is struggling to attend and complete his work, and Jacob is displaying behaviours which may be consistent with anxiety symptoms. She is concerned that his behaviour will impact upon his learning and would like some assistance. The learning support team discussed Jacob in their meeting and asked the school counsellor to observe Jacob in the classroom and report back to the learning support team. Case study questions. What changes in behaviour have you noted? Jacob struggles to manage the tasks which are set for him in class. He plays on his own in class, will not answer questions directed toward him, and Jacob becomes easily upset in class, including crying and body shaking. What mental health symptoms is Jacob displaying? Isolation from peers, becomes easily upset, physical shaking. What are your next steps from a school perspective? Conversation with family to gather further information about changes in behaviour at home. Discussion with learning and support team at school for further steps. What further information would you need to obtain? Does Jacob have an NDIS plan? Are there supports which he can access to assist him when he feels distressed? What referrals, pathways would you consider? School counselling support, allied health referral for supporting anxiety and distress.